I'm 22 News Statehouse reporter Jodi Reed. I'm here at the Statehouse sitting with Northampton State Representative Lindsay Sabadosa. Thank you so much, Representative Sabadosa, for sitting down with me today.
Of course, anytime.
So I wanted to talk about your Medicare For All plan, and I want to talk about, fundamentally how it would work and how it would be implemented at both the state and federal level.
Well, the Medicare For All plan, the legislation that I filed in the state of Massachusetts really only deals with Massachusetts. So the way it would be implemented on the federal level, that would be really great if that moves forward. And I think Representative Pramila Jayapal has presented a really clear plan for the federal level, but my focus has been on the state of Massachusetts because that's where I have a little bit of influence. So the legislation is something that has been filed for many years now. Senator Eldridge has really led this. I'm happy to join him on the House side. And the plan is really to just change how we fund health care. So I think it's confusing for people because we use the words Medicare for All and people say, oh, well, that's just expanded Medicare, or well, what about Medicaid? What about Mass Health? How is that all different from single payer? So I do think there's a lot of education we need to do around the issue, but fundamentally we're just talking about the way we fund health care. So right now, most people get their health insurance through their employer, and that would change. This system would change that. So instead of getting health insurance through your employer would pay a tax. I know a lot of people get afraid of the word tax, but we'll get to why this is a better plan in a second. So the employer would pay, I think it's 8.2%, and then the employee would pay the other part, and that would be like the 2.9. So it works out to be about 10%, and then the first $30,000 of payroll is excluded from that. So 10% total. Now, right now, the average person, when you take into account all of the things they're paying, because we don't just pay premiums, right? We pay copays, we pay deductibles, and then there's the part that we have a really hard time figuring out, the part that we're paying because we're not accessing care when we need it. So when you take all those costs into account as best we can, the average person is paying about 18% of their salary for health care. So bringing this down to 10% is actually a much better deal. And of course, if you make a lot more money, then you probably will be paying more, but I think that we live in a society where the wealthier should be paying more. And the people who have lesser means should be paying less, and we should make sure that everyone is taken care of, and this system would really ensure that that occurs.
What role does government play in that in terms of covering the rest of that 90%, or are they just the ones regulating, saying, we need the employer to pay X amount of money, then the rest will fall on the
well, so it's not that 90% isn't being taken care of. We're just saying the tax rate is 10%.
Okay.
So it's not like there's any leftover. That should take care of everything. We've had economists studying this and working out plans based on what our current costs are, based on what hospitals would need for reimbursements, what physicians would need, other practitioners. The really important part of this plan is that it covers all healthcare. So right now, depending on what your health insurance plan looks like, it might cover some aspects of healthcare, but it probably doesn't cover everything. And some of the biggest carve-outs are usually dental and chiropractic and glasses, anything related to your eyes. And so this would instead bring those things back into healthcare because they are fundamental aspects of healthcare. The government's role in doing this would really be to set up a trust. So there would be a healthcare trust that would manage these funds. So the tax would be paid into the trust, and then the trust would be responsible for paying providers.
Senator Bernie Sanders is proposing to do away with private health insurance providers.
Right.
What do you think of that plan?
So this would be very similar, quite honestly. It would create a state agency, and that would take the role of insurance companies out of healthcare. I understand that some people might think that's radical, but if we look around the rest of the world, this is actually how healthcare works in most countries. And there are health insurance companies that provide supplemental insurance and do different things. I have great faith in the health insurance companies that they will always find a way to be profitable. But this is about making sure that healthcare is healthcare, not health insurance, which is currently our system.
And what would you have to say to someone who says, I really like the coverage that I have now, and through this system, would I be mandated to switch? Would I be able to keep my provider? How would that look like for anyone else?
Yeah, so the system is different than current insurance because with current insurance, the insurance company actually tells you which providers you can and cannot have. So, for example, my own family, we recently switched insurance and we had to go through and make sure that all of our providers were still covered. We really like our providers. We had no interest in switching. A lot of times people say that they like their current coverage, but your coverage is never guaranteed. It changes from one year to the next. Providers can be in your provider pool at one point and then maybe they're not. This would end that practice of having provider pools. So if you like your provider, you keep your provider. Now, if you like your coverage, that's great, but we're offering a coverage where, we're hoping that it's actually better, that you don't have the cutouts. I think that in the end, you're not losing anything and you're standing to gain. And the other thing that you're gaining is that there's actual universal coverage, and that, when our health is better, so many other things follow.
Can we talk about prescription drug prices? Just,
Sure.
changing pace a little bit. How can we lower those?
Well, I think that the Medicare For All system is part of that. There are certainly other things that we can do in the interim, because I certainly don't believe that we're going to move to a single payer system overnight, although I think that would be lovely. I think that we do have some work to do about negotiations and who is allowed to negotiate with drug companies. I think that on the federal level, there's a lot they can do, particularly around patents and exclusivity. Other companies do not have patent exclusivity for as long as they do in the United States, and we see drug prices just dramatically lower really everywhere else in the world besides the United States. I can't think of another country that has this problem like we do.
Absolutely. And I want to get your opinion. The opioid crisis is ravaging across the country. What level of accountability does Big Pharma play in all of this?
Well, Big Pharma certainly plays a role in it. I think that we need to be careful to not think that the opioid crisis, though, just came from the use of prescription drugs. I think that, actual heroin on the streets plays a really big role in that. U.S. foreign policy and our war on drugs that have actually done the exact opposite play a really big role. But pharmaceutical companies should be held responsible for some of that, and I'm not really sure exactly what direction to take that in, but I think our Attorney General is on the right track.
In terms of punishing someone, do you think that lawsuits should be filed for these companies that knowingly misinformed their patients?
Absolutely. I think in this case, it's similar to the tobacco companies who, very knowingly got people addicted to cigarettes, and we've held them responsible over the years. I think the same needs to be done for the pharmaceutical companies.
Sure. So today, the budget debate starts,
Yes.
and you're going to be pushing for healthcare, a big healthcare bill this session.
Absolutely.
Can you talk to me about that process and what it's looking like moving forward?
Well, I don't know that we'll be talking too much about healthcare during the budget debate today, just because we're in the first year of the session. I think that we'll have more to talk about in the second budget debate of this session. So next year we'll start to push more policy through the budget if we see that policy is not moving through committee and through the legislative process. For me, this budget session is really all about revenue and starting a conversation about revenue. I was talking about how healthcare is so related to so many topics, and we know that our state is dramatically underfunding. It feels like everything. It feels like the austerity budgeting has impacted our schools, it's impacted transportation, it's impacted infrastructure. So if we're going to talk about what we're going to spend, we need to talk about what we're taking in. And I don't know that we're going to pass any revenue measures today, but I'm hopeful that we'll start the conversation.
And in terms of that debate, do you think that there's a general consensus about, including money for education and healthcare, or do you think it's an uphill battle?
Well, I think that we're talking about revenue, so that is always an uphill battle because people do tend to be tax averse. But I think there's a national movement right now to start that debate about revenue. We have the lowest tax rates we've had since, I believe, the early 90s. And our state is showing, we're starting to see the damage that has done. We are no longer Taxachusetts by any stretch of the imagination. Low personal income tax, low capital gains tax. And then we have, teachers across the state who are not being paid fairly. We have schools that are pitting themselves against each other to try to attract students. We have out-of-control transportation costs, public transportation that's just getting slashed left and right. People can't, get around. They can't get to their jobs. They certainly can't get to doctor's appointments. So I think that that's where the debate has to go, and people are starting to realize that it really does roll back to revenue.
In the foreseeable future, what do you see for the future of the Commonwealth in terms of healthcare coverage, education? Do you see a more comprehensive government approach?
I think that is the direction that we're heading in. I think that a lot of people, just regular citizens, are starting to say that the things are deeply interconnected and that they want government to have a bigger role in that. We've definitely moved in the direction of a hands-off approach, and we're seeing the effects of that. So if we were to turn that around and start looking at government not as some separate entity somewhere, but as an actual tool of the people to make sure that we're taking care of all of our residents, then we can see some actual progress. And I'm hopeful that that starts this session, and the budget debate today will just really be that first step.